We are joined here on Johnson County today by Western Missouri Medical Center's President CEO, Darinda J. How are you?
Good morning. I am doing great.
Good to see you. We've survived so far.
Absolutely. We have definitely made it towards recovery. So in this county, I do believe we peaked a little earlier than some of our surrounding counties. So if we can open gently and do the right things, I think we'll get through this.
What percentage of people with the COVID-19 had to be hospitalized? Do you have that number at all?
I really don't have that number.
Not very many, though, was it?
Well, here...
here, not hardly at all.
Well, we had 7 people hospitalized of our 53.
Yeah.
So a little over 10%, which I think is the national average.
About 10%. Mm-hmm. Is it not as severe as initially we thought it would be?
I think it still is right on mark with what they were thinking, but as we expand testing and do antibody testing and see how many people got it asymptomatically that didn't have symptoms, it could become less deadly, is what the literature is showing. So,
is antibody testing right now the thing?
That's the next thing. It's the thing. We do have the capability to do antibody testing at the hospital. We want to be on the front edge to make sure we're ready for whatever the government needs us to do to move forward and be open. And so we did start antibody testing last week. We did our employees first, and we're going to start next week. A little bit of a delay getting ready for the community, but I don't think it's a delay that's going to impact anybody. But we did do our employees. We did about 500 employees last week, and we had 2 positive antibody and 2 marginal, which means they probably are developing the antibodies, and so we'll retest them. So you can see that out of 500 people, we only had 4 people that have had it. What
does that tell you?
Well, first of all, only one of those persons knew they had it. So the symptoms,
they got a little sick.
The symptoms, they were not very sick at all. But the other 3 did not know they were sick, and so one totally did not know they were sick.
Surprise.
So it can be very mild, so you don't always know when you have it, which for me, that translates that we probably need to start doing random testing in the community because the whole point is to test and early isolate so that we don't spread it exponentially. Yeah. It's going to spread through our community eventually, or we'll make it to a vaccine, but that's about, a year out. And so, I think that is what it means. We need a random test because there are people walking around with it potentially that don't have any symptoms.
That's kind of a bad thing, isn't it?
It's kind of a bad thing, yeah.
You'd be spreading it and not even know you're doing it.
We're doing the right things though, because of all the precautions we're taking with masks and social distancing and cleaning. You can have it and still not transmit it to somebody else if you're doing all the right things. Yeah. So that's why it's even more important as we open back up that we continue. In my mind, there's 3 tenets to reopening that are really important for individuals, but particularly for businesses because businesses control the patterns of the people. So we have to continue whatever sanitation or cleaning schedule, whether it's cleaning out the belt in between groceries, if it's for at the hospital, it's cleaning in between patients, in between everything. So we have to continue that in every business, just like we are cleaning your mic between us.
Yeah.
And then secondly, the social distancing, everybody needs to continue with that because that is one of the most effective ways to prevent the spread is to be over 6 foot from people. So, for instance, at the hospital, we're going to continue those protocols of not using the waiting rooms, of people waiting in their car. And so for businesses that already have those social distancing protocols, they've been open, they need to continue that as we open the community. But thirdly, the most important thing I think that is really for businesses that are opening back up, and businesses, existing businesses, as we continue to see, because this isn't over, this doesn't mean we peaked and we're not going to have any more, but what's even more important is making sure you're monitoring your employees for illness, so for any type of symptom and getting them tested. So send them for testing, so that we get the testing back very quickly now. And if it's not COVID-19, then they can go back, normally just from feeling better or with their mask, and they're safe to work. But employers need to really, and employees need to take it very seriously and get tested if they're not feeling well, because you don't want to expose your whole workforce, nor do you want to expose the community as we open it back up.
Do you get same-day results?
Within 24 hours.
24, okay. And I got a question here I wanted to ask you. Number one symptom of people who get tested. What is the number one thing that you see?
Cough or fever.
Either one, cough or fever.
Those are the two.
Or both.
Those have been our two cardinal signs that we test. We are considering opening that up because it was on the Today Show the other day. There's many more symptoms that they're finding are indicative. So I think it's really, if you're feeling under the weather and you're working at a community spot that people are going to go and patron at, maybe you need to be tested. So the more testing we do, the better. Just like, that's all the buzz, is that we have to have increased testing. We have the ability to test in this community. We are very fortunate that we got on it early and that we have really great facilities. So
you're not going to run out of kits?
We are not going to run out of kits. We can test thousands of people. And so that's a benefit for this community, because we have known where we're at for a long time. But at this point, we're only testing sick people. So we're considering opening that up to
anybody
slightly sick people. Yeah. So that more stuff will be coming out about that, so that people know what to do.
Asymptomatic person has no indication at all?
Oh, I think they feel a little under the weather, but they don't know that it's COVID under the weather.
Yeah.
So one of the employees that we interviewed that had antibodies forming, she said she didn't feel very good. She just didn't feel good under the weather for a couple of weeks. And so, but she didn't know.
Do you think we actually had some of these back in November, December?
No.
No, we didn't. There are people who are saying that.
I know people think that, but the more I read, the less I believe about that. If we did have any in January, I don't believe we had it before the new year. If we did have any in January, it was probably on the coast from travel.
Yeah.
But here, for instance, locally, every one of us, and this got misconstrued last week when I said we were going to do the antibody test. Somebody was like, why does she say she wants it? I don't want COVID, but I want to have the antibody so that I've already have had it and I got through it safely. So we were all like, oh, I hope we have the antibody. Maybe that sickness we had in February, we had it, and none of us.
It just hasn't turned out that way at all then.
No, I was even in New Orleans at Mardi Gras, and I don't have any antibodies. So.
Oh, you were in New Orleans. I'm going to tell you a story about that. I have a friend who is a musician in New Orleans. He lives with like a bunch of folks in a house. 5 of them went to the Mardi Gras parade. He says, I'm not a parade guy, I didn't go. Those 5 people are dead now.
It is really crazy. To give some perspective of how different it is in other communities, we see a lot about New York, and New York obviously was overrun. But I went to New Orleans to get married right before Mardi Gras. So right before Fat Tuesday, we left. So just a couple days for Fat Tuesday, but we did go to several parades. And it wasn't the thing at the time here. So we weren't even thinking about it. So we came back, and then right after that, they're blaming, within 3 or 4 days after we left, they're blaming that was the parade and that's where it spread. Because about 14 days later, they started seeing cases. They have 25,000 cases in New Orleans. And one of the normal community hospitals I read about the other day, they had a celebration. They discharged their 1,500th patient. One little hospital discharged 1,500 patients with COVID-19. So to put that in perspective of, it can get overwhelming. So Kansas City, we're very fortunate. We've done a very good job in the Midwest. We've done a very good job in Missouri, St. Louis, and Kansas City, both alike. So that's the kind of response. And having parades, they tell you that, even in the 1918 flu, that's how St. Louis fought it off. They didn't have their parade. Philadelphia did. I'm sure everybody's heard those stories. But so we've done the right things. Now, so the thing about the state order that just came out to open up, I am thrilled to open up. Just like every other business, the hospital's ready to see people. We're ready to work. We want us all to be out doing the things that we need to do. I do miss getting my hair done. I miss shopping. But I am worried. The only part that I'm worried about is the mass gatherings, because
then you can really spread quick if that happens.
if you are close at mass gatherings, you know, just like I was just saying about parades, that's how you spread quickly.
Yeah.
And so we don't want to be some of those factories that have had spread in their employees. So we need to be careful and watch our employees and get them tested. And we have a group at the county level, a business education group that's from our task force that, and it's led by someone at my institution. They will come out and help any institution with cleaning protocols, social distancing protocols, or employee protocols to return to work and those kinds of things. But the mass gatherings, that one makes me nervous. I think we'll have to be careful, not to make sure that if we are together somewhere, that we are far apart. So just like yesterday, we watched the B2 go over. There were a couple hundred of us outside at the hospital, but we were all, you know, in the parking lot was what I'm talking about. The public, when I'm looking at the public that came out, you know, everybody was 6 feet apart from each other except with their family. So we just have to kind of continue this way of life for a while. I think it's going to take a while for us to get back to normal.
But you think we're ready for it to get back to some sort of normal?
Is what everyone needs to know, and this is important, is there are many, many interpretations of how to get back to normal from every organization that I am a member of or even talk to. So putting those together sometimes is overwhelming, even for us who are dealing with it every day. But we are meeting the criteria for recovery. One of the things about all of this stay at home was you didn't want to overwhelm healthcare. Well, Missouri healthcare is ready. We have space. We have capacity. We have not had the surge that caused a cripple or crisis in healthcare. So that's one of the things is, do you have the capacity to take care of patients in your hospital without crisis? Absolutely. We have plenty of capacity. We haven't had a COVID patient admitted. I think it's been over 10 days.
Yeah.
We're doing great. We also have a downward trend in active cases since the 15th. Now, to make sure the public understands that, on the 15th, we started trending downward of our active cases. That makes sense because we started staying home April 1st. Yeah. So 14 days later, after the incubation periods, you know, during that first 14 days, we were at home, we weren't exposing each other, and then our rate started going down. So the first 15 days of May, I don't think we'll see a huge increase because we're still going to be showing this disease from what we're doing right now. Yeah. But the second 15 days in May, I suspect we'll have some increased cases. It's not going to be overwhelming, which is the key point. Yeah. But it's proof that April worked. It works to social distance. It works to stay away from people. It works to wear your mask, wash your hands, not touch your face. But then the other metric that we are steady on, and this is on the gating criteria for the national level, our percent of positive tests has remained very steady for actually the entire month of April. We've been in about 5.5% positive. So of the 1,000 tests, we're about 5% positive, and we have been steady. And that's one of the gating criteria, is to have a decrease or steady in that, not an increase. And you can see prior to April 2nd, when you look at our percentages, we were as high as 9 and 10% on a rolling 7-day percent of positive per test. So we have stabilized that in our community, and we're not increasing at this time. So we meet all the criteria to safely, for the health department, for the commissioners, for all of us, the hospital, all of us, to recommend opening. We do meet that criteria. Yeah. Okay. And I think we have a task force that I'm one of the leaders for, the reentry task force, and we want to help businesses be successful because it will affect. We understand the sacrifice that we have all made financially with our businesses, because we have all made a financial sacrifice individually and in businesses, but we want to make it safe. We don't want to go back, so we want to give advice and support businesses so that we can go back safely. Let's get back to it, but safely.
The hospital has actually correct me if I'm wrong here, but I think I heard this, as a few days in there where you had no patients at all in the hospital. Did you or not?
No, we have not had any days that we didn't have any patients.
But very few then. I mean,
We have had
one or two or three?
less than 10.
Less than 10. Mm-hmm. That hurts the budget, doesn't it?
Very much so. People, it takes a minimum amount of people to run a big organization like that.
Yeah.
And so there's real costs to running an organization, that keeping the ER open, having the testing available. You can't just shut down those things because you still need those for the emergency type cases. So we still have a full OR crew. We still have an anesthesia physician crew. We still have full ER staff. We still have all those things that make the world go round and make us be able to run a hospital. And then less than 10 patients and 30 ER patients, half.
Yeah.
So we have felt the crunch, and I see this on Facebook a lot. People will say, well, why? I thought the hospitals were overwhelmed. It's true. And in those big cities, they were. We have not been here. We were well prepared. We had some advance notice. We did a lot of planning in March to be ready. We have surge plans. We have all these plans that allow us to balloon up if we were to have a surge. But because people are doing the right thing and staying home, they're not getting as sick. They're not getting sick as frequently, and they haven't been seeking health care. Now, I want people to know, though, it is perfectly safe to get health care. I do worry about the people that might be putting off things that they need, I think I mentioned this before. Our stroke activation in the ER is down significantly. Like, it's less than a quarter of what it normally is. So our stroke program is really effective, and we've saved lots of lives through people, the ambulance bringing strokes to our ER. We're certified as a stroke ready hospital, and we do things. And it doesn't make sense why only 25% of the patients that normally have strokes in a month are having strokes right now, except unless we're just all so stressed from working. I don't know. But I worry people are at home having symptoms of strokes and not seeking health care because they're afraid.
Afraid to go to the hospital.
And that makes me upset, because we've done a lot to try and make sure and take care of those types of conditions. And so for people to have bad outcomes because they're afraid to come because of COVID, when it is really perfectly safe. We are all masked. We have rigorous cleaning protocols. I think the proof is in the pudding. None of my staff have gotten COVID-19 from any of the COVID exposures and patients we've had. Yeah. So we only had one positive employee that out of the 125 that we've tested when they've been sick, and that was an exposure outside of work.
It wasn't even from the hospital.
Wasn't even from the hospital. And so the 4 antibody positive people, I mean, it's pretty clear that we have really good protocols to make sure that we're not spreading it. Yeah. And our physicians are so passionate about trying to do the right things. And I mean, we have a group of physicians that are surgeons that are trying to make sure that all of our procedures in the surgery area, because not only do we want to keep patients safe, but our number one focus in the hospital is making our staff feel safe, be safe, feel safe. And so we're doing all the right protocols to make sure we're not transmitting it at the hospital.
Virtual visits, how long are we going to continue to do those?
As long as the government will pay us to do it. It is very effective for some patients. It is not as effective for some things, and so we're gonna open up too. I mean, we're gonna start letting patients come into clinics if they want to see their physician. Yeah. We don't wait in the waiting rooms. We clean rigorously in between patients. It's safe. We're all masked. The patient's masked. The staff is masked. We actually wear goggles and masks in patient care areas, which is the standard. And so it is safe. We don't want to get it from each other any more than we want to give it to you. So we have really honestly been cutting edge on all of our protocols at the hospital, across our whole system, the clinics and the hospital. And so I'm super proud of our staff. I think we all feel really proud to work for an organization that pulled together and have worked so hard to keep each other safe and the community safe. And so we just assume everybody has it. Yeah. Honestly, everyone has it, and so we take those protocols no matter what. So we take precautions at all times, and I think that's what keeps us safe.
When do you think it'll be business as usual at the hospital? How long is that going to take? Now? Are you ready for that now? No?
Oh, we're ready, but
you don't think we need to do that now then?
I don't think people will come back for a while. I think people are going to continue to take it slow. I think it'll be fall when people start getting sick again. That for
This will come
other
back,
things. Oh, it's not going to go away, but it's once we get back to a semblance of normal, if we reopen right and we don't have a surge and we just gently spread it through our community like you're supposed to, then when we get
Call it herd
immunity. And so the two things we're going for is herd immunity, which is 80% of us have antibodies against it, which means 80% of us have had it, or a vaccine. Either way, that's going to take us over a year. It's going to be next year. Meantime, I'm planning that everybody will feel confident enough in their own actions and the actions they see in the surroundings around them that they're going to feel safe coming to the hospital to get the care they need. We're going to start doing screening colonoscopies. We're going to start doing screening mammograms. Yeah. Our physicians, nor me, I would want to have people come there if we did not think it was safe. And so we're working really hard to make sure people are safe. But I still think it's going to take several months for people to really venture out and get past this fear, and we'll have to wait and see what happens. I mean, I'm anxious to see what happens in the nation, because if the media paints it very scary, then that'll delay all of us again.
Yeah, and there are some who are painting it a little scary right now. I just read something about Georgia, for instance. They're not set up like Missouri is.
I haven't read a lot about that. I did see a
I
funny
read
joke
that
about
this
it,
morning,
but
they don't have the criteria in place that has happened like Missouri, where they're maybe in a little bit of, if they take it too quickly there.
Every county is doing it a little differently. I suspect our neighboring counties, because Saline is a hot spot right now.
Yeah.
Pettis is kind of on the rise. They were a few weeks behind us in their disease.
Yeah.
And so they're on the rise right now. And I used to think it was because they're starting to do more testing, but they actually have more active cases than we do. So they actually have more than we do. So and then Lafayette's had more deaths and cases than we have. So I think that those counties will probably have a little bit more restrictive reentry than we will. We are doing really well. And so we just want to keep it nice and easy and support the businesses to do it safely.
Is there any theory at all of why it affects some people so severely and others not hardly at all?
Well, I mean, anybody with comorbidities can be exacerbated by COVID.
Yeah.
So obviously...
But still, there are young athletic people who are being killed by it.
There are, but that's just like anything. I mean, we're hearing those really unique stories because it's a good story. But athletes across America die of weird things on the regular, so healthy people do die. And so I don't think they really know why or who it attacks differently. And I think that's what makes it scary. I was scared in the beginning for myself, for my family, for people I loved. But all you can do is do what you can do. And so keep yourself safe, keep your family safe. In my instance, keep the community safe at the hospital, and just plan for the best, and keep testing yourself, if you're sick.
Sounds like you've done a good job of it, Darinda. It really does.
It's been challenging, but it's been a really good opportunity for us to really come together and work together as a community. Our task force, our COVID-19 task force, that's led by all the community leaders through the Johnson County EMA. It's been a great opportunity for us to work together and make sure that we're coordinating all of our efforts. And
we'll help down the road when we get into other situations like
That's
this.
Right.
And that comes around.
Yeah, the plan.
Flu season every year.
Yes, the plan would be for us not to have another pandemic.
Yeah,
and
yeah.
I read last night that they were like, hopefully we haven't created a culture where you do this every time the flu season comes, in America.
Yeah.
And so, but we have a vaccine for flu, and we have done a really good job of encouraging, we require the flu vaccine for our employees so that we're not spreading it to each other or spreading it to our patients. And so, a lot of people get the flu vaccine, and that's why it's not as deadly as it used to be.
Yeah.
And so...
Thank you for coming today and enlightening us a little bit
No
on
problem.
what's going on.
I encourage people to reach out to the health department if they need help with any of these reentry plans, with social distancing, cleaning, or employee protocols, because we do have people available to help. So
if they want to open up their business and how they should do it properly and all that.
just want some advice,
Yeah.
we can help.
Thank you for coming.
No, thanks for having me.
We'll probably get to do this again sometime down the road, I would imagine. Darinda J, who is the Western Missouri Medical Center president and CEO, visiting with us today on COCO.
With the 2020 year